Thank you so much, Sorry. Good morning, everyone. Well, I guess almost afternoon. And thank you for having me at this week's Connecticut Nonprofit Alliance conference. I'm really thrilled to be here to talk to you all about well-being, which is such an important topic, and especially for a conference theme around becoming stronger together. I am a senior manager at BerryDunn. BerryDunn is an accounting and consulting firm, and I lead our well-being consulting practice and also our firm's internal well-being initiative. Throughout my life and certainly my career at BerryDunn, I've always been a big well-being advocate. I learned through a lot of trial and error that I certainly produce better results, both personally and professionally, when I'm able to focus on my own well-being. And I've worked really hard to build that into my life. In doing so, I've also come to realize how important where you work is to your well-being, the people you surround yourself with, the work environment, and even just the nature of the work that you do. So I really believe that the ability to take control of your well-being and to be in an environment that enables you to do that is something that should be available to everyone and to the benefit of everyone. So today for our agenda, I have just a little bit of an introduction, then I want to talk about the difference between wellness and well-being, and then we'll talk about how we can create a culture of well-being, where to begin with actually operationalizing well-being in your organization, and then hopefully there'll be some time for discussion. I've also planned for some audience interaction, so I'm hoping that people are ready to participate in the chat and share some ideas. All right, so for today, we have a few learning objectives. The first is to understand the difference between wellness and well-being, to understand why well-being is an important business strategy, and then also to be able to start identifying opportunities for operationalizing well-being within your organization. So we are now in the midst of a fourth industrial revolution, which is really changing the way organizations create value and how individuals communicate and interact. Advances in technology provide countless opportunities for positive change, yet they also present a lot of challenges. So technological innovation has left us more connected than ever before, yet at the same time, loneliness rates have doubled since the 1980s. We have more data and information at our fingertips than we ever really thought possible. And we also have more technology advancements supporting productivity and efficiency. Yet at the same time, I think we can all agree that we're tired and burned out, or many of us are. And in other words, we have chronically unmanaged stress, leading to loss of engagement, cynicism, decreased productivity at work. In a recent estimate, Gallup estimated that the cost associated with burnout is about 15 to 20% of payroll costs due to voluntary turnover. And that there's about $322 billion of turnover and lost productivity costs globally due to burnout. So in today's world, where it's easy to be productive and efficient, it's also easy to keep taking on more. When we are used to things happening quickly, we forget how to slow down and tune into the needs of our bodies, our minds, and our spirits. We also miss opportunities to connect with each other. Taking care of ourselves, connecting with others, it requires greater intentionality than ever before. And 30 years ago, taking care of yourself was strictly a personal matter. Today, the lines between work and life are blurred more than ever. And people are really seeking work that adds value to their life. Nonprofits certainly have an edge here by providing very purposeful work, but purpose alone is not enough when we talk about well-being. It's very important, but it does not stand alone. All right, so let's talk about well-being versus wellness. So people love to use these terms interchangeably, and it's true that they are closely related, but there are also some pretty clear distinctions. So wellness, state of being in good health, often refers to your, physical health, maybe mental health as well. Well-being is more about how you think and feel about your life. So you can be physically well, yet have low well-being. About 85% of US companies with more than 1,000 employees and over 50% of companies of all sizes have wellness programs today. They're often oriented towards reducing healthcare costs and absenteeism. The healthcare cost focus is certainly appropriate. 75% of medical costs can be attributable to largely preventable conditions. However, research suggests that these wellness programs, they're just not working. And in some cases where financial incentives are employed, they may not even be appropriate. So by broadening the focus to well-being, we can gain much more meaningful benefits. So a key difference with well-being is this culture focus versus a benefits focus. We're really focusing on value, more human-centered workplace. And in doing that, we really try to define well-being in a more comprehensive manner and think about meeting employees where they're at in their own well-being journey and recognizing that everyone has a unique definition of well-being. For instance, you may have an employee who is physically unwell, but has other challenges that prevent them from addressing their physical health. A well-being program, it's all about making a variety of resources and tools available to your employees, while also building a culture of support, saying that we trust you to know what's best for you at this particular stage of life, and we're here to help you to the extent that you would like us to. This is a much more effective approach to supporting positive and long-term sustainable behavior change. So I like to summarize the difference by saying that wellness programs are often viewed as this layer that exists outside of work, these kind of side benefits, something that's offered and available for use during your free time, or if you take initiative to use it. Whereas with well-being, we really try to bake it into the way that we work and connect with others. Just check the chat real quick. Okay, good. All right. So well-being, it's not only the nice thing to do, it also makes a lot of business sense. There's actually this human relations theory has been around for nearly a century and states that higher employee well-being results in better organizational performance. So this came to be, I think, in the 1920s or so. And despite all the advances in technology and innovation, current research continues to support that, yes, the human really matters in terms of our organizational performance. And there is a large body of research that does support the business outcome. So I personally really enjoy, I like the Global Happiness Council did a meta-analysis of about 300 different research studies and found that there was a favorable correlation between employee well-being and customer satisfaction, employee productivity, profitability, decreased turnover. There are also numerous studies that do support a link between well-being programs and returns in the form of reduced healthcare costs. Those studies are very challenging to conduct. There's just so many variables. So there's a wide range of outcomes. I've seen anywhere from an ROI of $1.50 for every dollar invested in well-being to upwards of $4 for every dollar. But the point is that I've never seen a study that suggested anything except a positive outcome in helping with healthcare costs, at least managing them and maintaining them. And then absenteeism and presenteeism, those are other kind of key topics. Of course, reduced time lost due to illness is important, but also presenteeism. And this is really talking about employee engagement. Presenteeism is when you have employees, in their desks at their computers, but they're not engaged and they're not productive. So focusing on well-being has also been shown to help reduce that. And I've just included a couple of sources on the bottom. There are just so many, but it's always nice to have a few citations to support some of these statistics. All right, so I'd like to get the audience involved here a little bit. And sorry, I'm kind of looking at two screens up right now and my chat's over to the left. But we at BerryDunn, we have 5 dimensions of well-being that we use within our firm, including physical, social, mental, financial, and career, as shown on the screen. And this is often what we recommend as a starting point with our clients, although some organizations may choose different or additional dimensions. But what I'd love to do today is walk through each one of these and hear from the audience a couple of examples of what you're doing in your organizations to support these different dimensions of well-being. So I'm going to start us off with physical well-being. That one tends to be the most straightforward of the 5. And I'd love to just open it up. Does anyone have a couple examples of how we support, and I have a couple kind of keywords here, how people stay active, how they fuel their bodies, and how they rest and recover at work? I know there's got to be some organizations out there who are doing some things here. Does anyone have a reimbursement program or do activity challenges? Okay, we're getting some good ideas coming in here. Wellness October, so having a theme month around wellness, that's great. You can do lots of fun things around that. Financial incentives for showing proof of vaccination and staff taking health assessments. That's great. Incentives can work as long as they're not too heavy-handed. Small incentives, I think, make a difference, but when employees start to feel coerced into certain behaviors, that's where they become a little more problematic. But we certainly use them in our firm, and they're quite effective. Virtual Workout Wednesday, that's fantastic. The virtual exercise programs have really taken off in the past 2 years for obvious reasons. Steps challenge with steps counters, reimbursements, virtual yoga. Great examples. Leveraging wellness incentives through insurance. That's insurance companies are starting to step up to the plate more and more too in terms of how they support their clients, their business clients with well-being offerings. All right, great. Well, thank you everyone for sharing. Those are some great examples. Let's move to the next one here, which is mental well-being. And mental well-being, it has both a mental health component and a well-being component. Destigmatizing mental health in the workplace, that's been, of course, quite a focus area recently. Also, how do we build more resilient teams, and how do we help people manage stress? Does anyone have some examples to share around different ways they're supporting mental health in their workplaces? All right, a program that works between doctors and clients as a referral reimbursement program for physical and mental health. Nice, very good. Any other examples? Art therapy. That is really cool. I have not encountered that. We actually considered doing something similar in the firm last year. It didn't quite take off, but that sounds like very unique and also very therapeutic. Mindfulness and meditation sessions. Those can be fantastic. A wellness room. I'd love to know more about the wellness room. And an embrace committee. Activities for staff. Oh, wow, that's great. Learning about various cultures and food, book clubs, all kinds of things happening with the Embrace Committee. So really, the mental health, it's about that connection, it's about that stress management. And then the EAP program. Yeah, trying to increase utilization of EAP. EAP is such a great and often underutilized resource. All right, and then keep us moving here. So we then have social well-being. Social well-being it's really important, and it's kind of one of those. At least in my experience, there's some very obvious things you can do, like outings and holiday parties and that sort of thing to promote social well-being. But how do you do ongoing connection throughout the year? It's not quite as straightforward, but super important. There was recently a study done by Work Better that showed that a widespread feeling of belonging in the workplace led to a 56% increase in job satisfaction, a 50% reduction in turnover risk, and a 75% decrease in employee sick days. I think we can all agree that after the last 2 years, and learning how to live in this world of virtual and hybrid work, connection's been hard. So would love to hear any examples of how people are promoting that sense of belonging, community, and connection. I think some of the examples shared actually also, a lot of times there is overlap between the dimensions. So we've already seen some examples. Certainly the Embrace Committee, I think, is a good one around the community piece. Town hall meetings, giving people an opportunity to come together and share what's on their mind. Employee recognition, that's huge, making sure people feel appreciated. I recently talked to an HR director that was very focused on finding ways to surprise and delight employees, which I thought was a fun way to look at it. Nice, virtual meetings between executive staff, each program model, great. And this is where it really comes back to that intentionality, especially if you're working remotely. It's so easy to just, get in your bubble and not reach out unless you have to do it as part of your, transactional day-to-day business operations. But this is where that intentionality is really important in staying connected. All right, so financial well-being. Finances can be one of the top contributors to of stress for employees. So financial well-being is as much about having a living wage and paying people fairly as it is about supporting people to meet their financial goals, whatever their income may be. Does anyone have any examples of how they're supporting financial well-being? Is anyone doing any financial coaching or providing any budgeting tools to employees? Certainly creating awareness around 401k, retirement planning and matching programs, if you have them. I'm going to just keep us moving because our time is quickly ticking by. Career well-being, possibly one of maybe the most important element here, if I had to pick one. So this is all about supporting employees to have that autonomy, mastery, and purpose. I don't know if there are any Daniel Pink followers out there, but making sure people feel like they have control over their careers, that they're able to continue to grow and develop, that they have a clear sense of purpose and how they contribute value to the organization. And then I like this new, reinvention for retention. So giving people opportunities to shift their jobs. Sometimes people are very much supportive of the organization, but just are looking for a change. And rather than losing people, giving them the opportunity to sit down and kind of rework what their job is. Any examples anyone wants to share? We got some good financial well-being examples. Any examples in the career well-being that people would like to share? Coaching and development meetings, monthly performance evaluations, productive and creative staffing meetings. That's great. LinkedIn Learning. Use those tools that are out there. There are a lot of fantastic tools. LinkedIn Learning is a good example. I recently signed up for Masterclass, which has been really fun. But yeah, there's a lot of great content. So if you can use that, find the good content and get it in front of your employees, that's fantastic. All right, well, training opportunities. Training is so important. Being a learning organization, really important. Big picture, to find a career opportunity that best fits them. That's perfect. All right, thank you everyone for sharing those examples. That was fun. I'm going to keep us moving. And one more thing on the dimensions, these are just the dimensions we choose. You can definitely, every organization is unique, and you certainly should tailor the dimensions to your environment. So just kidding about the chat. We do have one more question I'd like to ask everyone, and then I think that will be it for the chat portion for now, at least. But as you start to think about well-being and the different ways you're supporting it, what would you say your greatest challenges are related to promoting employee well-being? Does anyone want to share? I know a lot of times with the organizations that we talk to, it's really engagement. You can put out a lot of great programming, a lot of great benefits, but and a lot of times the people that would benefit the most are the least likely to engage, or are the hardest to get to engage. So that's certainly a challenge that we see. And I like to encourage our clients not to get too hung up on specific engagement with the programs, resources, and benefits, but again, thinking about bigger picture, you're really going to have 3 layers of people who participate in your well-being programs. You're going to have the people who show up and use everything. You're going to have the people who come when they need it. And you're going to have the people who just benefit from the environment, the culture that you cultivate by consistently putting options out there and saying that this is something that's important to our organization. They may decide to seek out their own opportunities to do that self-care and take care of their well-being. But it's really about making a statement that this is important to the organization. So some things are coming in. Employee buy-in, yep, definitely. Getting people, and it's hard, and we'll talk a little bit more about why it's hard. There's a lot of distractions. People are busy. They're trying to get their work done. So how do you really, again, bake well-being into work and not make it another line item? Well-being can't be another thing on people's to-do list. Buy-in again, engaged, very spread out across the country. Yes, absolutely. BerryDunn. We've been dealing with that too. Our firm's grown significantly, and I think almost 40% of our workforce is now remote, and about 60% of the rest of the workforce, many of us are hybrid now, so, and all over the country. So you really need to kind of, every time you make a decision about your well-being offerings, you need to put it through that lens of, okay, how are we going to do this for both our people in the offices and also our people who are remote? Yeah, and capacity of staff taking on the responsibility to implement. That's a great point. You really do need somebody with a designated responsibility around well-being. It doesn't need to be their full-time job. In very small organizations, you might be able to get away without doing that, but really, it's in many organizations, it's becoming a designated role. We just hired our first well-being manager. And I know there are many much larger organizations who have chief well-being officers now. That's becoming more of a common thing. All right. Well, thank you, everyone. Let's keep us moving. All right. So I think it's helpful to have a framework for as we think about how we actually operationalize well-being, build well-being into the culture. So this is something we've developed at BerryDunn to help with that. So we talked about the 5 dimensions. The 5 dimensions are incredibly important. We want to start by ensuring that there are programs, resources, and benefits in place for each dimension of well-being, and that they're right sized to your organization. They can be simple or robust. But in getting the resources in place is fundamental, but just doing that is not enough. To really recognize the transformational potential of well-being investments, you need to focus most of your energy on the work environment. So instead of build it and they will come, you really need to live it and they will come, thinking about buy-in and engagement. So when we talk about the work environment, there's really 5 components. The first one is leadership sponsorship. So getting that commitment and buy-in from the top, making sure it's consistently communicated, and making sure it's part of the leadership dialogue on a consistent basis. Having positive teams, ensuring that your policies and practices promote connection over competition, having environments that just promote connection, recognizing behaviors, making people feel appreciated and valued. Strong onboarding practices are important here. And then, team building and just taking a personal interest in your employees. Flexibility, recognizing that different people do their best work at different times, at different speeds, and different environments. And to the extent practical for each role, exploring ways to support different work arrangements while also putting in place policies and practices that keep your teams coordinated and connected. Manager engagement. Managers are the multipliers of your well-being strategy. Your managers should understand the organization's commitment to well-being, should lead by example, get your managers to proudly take their PTO, and also be equipped to respond to their team's challenges, whether that means leading the evaluation and adjustment of job design, checking in on plans for paid time off, not sending emails late at night or on weekends, or at least encouraging staff to understand that they don't need to respond to them immediately. And again, just taking an active interest in their teams. Those soft skills are becoming more important than ever. And then your built environment. Space is really important. People should have comfortable working environments that limit distractions, also provide the opportunity for connection and collaboration. Natural light's important, cleanliness, access to nature if you can, that really makes a difference. Then also your virtual space is just as important as your physical space, especially today. So making sure you have secure and reliable technology to support collaboration. All right, so we've talked about why well-being is important and the different elements that contribute to a culture of well-being. But as a nonprofit leader or manager, you may be wondering what's an approachable first step for actually implementing a well-being strategy or for strengthening our existing wellness or well-being program. There's many ways you can begin operationalizing well-being as part of your nonprofit operations. I'm just going to share a few examples that have resonated with some of our clients. So the first one is a burnout risk assessment. If burnout is a particular concern for you, I'd encourage you to start by evaluating which of these common burnout accelerants exists in your organization and to what degree. Many of these can be traced back to the work environment elements that I shared in the previous slide, while others are quite simply related to operational dysfunction. Now, these elements all exist in most organizations to some degree. The key here is to identify which areas of your organization experience the highest level of stress, and then consider which of these accelerants are most prevalent. From there, you can choose one or even a few areas to focus on. So again, with well-being, it's really important, big picture, whether you're hoping people exercise more, take time off, or set better boundaries, your employees aren't going to embrace those behaviors if they can't get their work done efficiently, if they don't feel appreciated, or they feel they can't say no to things. When the culture is right for burnout, you're going to get one of three things. Your employees are either going to disengage, they're going to quit, or they're going to muster through to the detriment of their health. So a burnout risk assessment is a great place to start to identify a few areas of focus and start making improvements. So the next idea is thinking about well-being packaging and promotion, doing more with what you have. So a lot of times organizations are already doing so many great things to support well-being, and people just either don't know about them or they forget about them. So what this comes down to is marketing, really. So a good step to start with is to first define your dimensions. So we had the 5 that we talked about earlier. What are the dimensions for your organization? Come up with some definitions that are tailored to your organization. And then take either a big piece of paper or go to a whiteboard, write down your 5 dimensions, and just start listing off the things that you do in each of those dimensions. I also suggest as part of this to sit down, if you haven't already, with your insurance contact at your insurance company, and make sure you really understand what they offer in terms of like preventative well-being oriented care. For example, at BerryDunn, for many years, we've covered nutrition counseling at 100% before our employees meet their deductible. That's something that employees really didn't know about. I'm passionate about nutrition, and I had no idea about this until we sat down and did this very thing. So really understanding your insurance companies. Insurance companies are doing more and more these days, so that's a key part of this exercise. And then it's really just identifying the channels for promotion, creating materials, engaging your leaders and managers. This helps ensure that leadership is supportive and aware. And it's great if you can find opportunities for leadership to participate or bring awareness to offerings. And the same thing with managers. Just, you don't want this stuff to exist in a silo. And then, of course, identifying and planning opportunities to promote your well-being program throughout the year, not a one-time thing. All right, next slide. All right, so a survey. It is really important to understand the needs of your population and how you are currently doing at achieving your organization's goals. An annual well-being survey can be a great way to start an initial assessment of how your organization is doing and set baselines for measuring improvements. It's also important that if you do a survey, you communicate the outcomes and make sure employees know that they were heard and that the organization is actually taking action on the results. So I've shared a few slides from our annual well-being survey. So the first one, and this is, we do a comparative year to year. We ask people to rank their personal well-being in each of the 5 dimensions. We ask them to rank how well supported they feel by the organization from one year to the next, or in the current year. This actually was quite, this was a big success for us, because when we did our 2020 survey, it was early February, so this was pre-COVID. And our 2021 survey was, of course, done in the following February. And we saw that people felt more supported in their well-being during COVID than they did before. So we felt really good about that. And then we also asked people to identify their top challenges related to each dimension. And then we asked them to provide some open comment on how we can better support them. And again, we try to identify those themes and communicate them back to everyone. All right, so just some kind of closing thoughts on considerations for nonprofits, and then I think we'll have a few minutes for some questions. So earlier I talked about purpose. Purpose is baked into the nonprofit model, and certainly use that to your advantage and help people craft jobs that align their strengths with your mission. Do not underestimate the power of consistently communicating the impact of your organization and celebrating the difference your employees make. But as the slide says, it's your edge. It is a double-sided edge. Be aware that purpose can be a risk factor for burnout. Passion can fuel burnout. It's easy to say yes to everything and take on too much. So you, being in the nonprofit world, may have heard this referred to as generosity burnout. Right-sized strategy is really key. In this new era of work, every organization can and should have some level of a well-being strategy. But be aware there are a lot of shiny objects in the world of well-being, particularly around technology. There's just an explosion of apps and companies who are coming up with a lot of great tools to support well-being. But you start with the basics. And to make sure that you're investing your time and money strategically, it's important to understand the needs of your survey. Consider the needs of your employees. So consider a survey. Maybe do some focus groups with your people. Extend the conversation beyond where it typically occurs, which is in human resources, and try to involve some other key stakeholders and members of the leadership team. Something else we are seeing with more of our clients is this idea of building well-being into large projects. This is a great way to make well-being part of the way we work. Say you have a large system implementation project coming up, or a big fundraising campaign. identify opportunities to make well-being part of the project plan to help manage periods of high stress, and really support people to bring their best to projects and finish strong. Managing expectations is important too when we talk about well-being. Some changes will come fast, but it's a long game. The bigger cultural shifts take time. Keep your managers and your leaders accountable by making well-being a regular part of the leadership agenda. I'll just say you can certainly do all these things on your own. There's a lot that organizations can do independently when it comes to well-being, but you can also ask for help. I encourage anyone who's interested. I'm always happy to talk about well-being. This is a subject I'm clearly passionate about and always open to have a conversation, either just as a sounding board or if you're interested in getting some assistance. I like to kind of close things out with a re-emphasis on the comprehensive approach to well-being. This is just a very simplified version. I think most people can probably appreciate this symbiotic relationship between personal and professional well-being. But I really like this slide because it helps me answer the question, how do you know when your well-being program is working? So the reality is that we not only know people who fall into each of these quadrants, but we ourselves are likely to spend time in each of these quadrants throughout our life and career. So, ideally we want to be thriving. There's going to be times we're struggling, hopefully not too many times we're suffering, but the key is a well-being program is not intended to keep everyone in the thrive quadrant all the time. Instead, it's intended to make sure that there is a dialogue and support resources to help get people back to thrive. So I like to think you really know your well-being program is working when people find themselves in one of these quadrants, and instead of leaving the company or accepting the sacrifice to their physical or their mental health, they start a conversation or they make a change to get themselves back on track. It's all about creating awareness, making well-being part of the organization's values, and making sure there are pathways available to get people back on track. So with that, I open it up to any closing perspectives discussion. I'd love to hear if there are aspects of our discussion that resonate most. And I can also take a look at the questions that have been asked. So I will start there with Heather's question. Do you have any advice about navigating the fine line between employer-encouraged activity and personal choice? Yes, I think that's a very important line to manage. As I said earlier, the moment that employees start to feel coerced by your well-being program is the moment that you're going to start losing engagement. So I think it's really important to give people choice. So not saying this is that we do an activity challenge and you need to participate in the activity challenge in order to, be qualified for this incentive or, that sort of a thing. But instead having different pathways for people to participate in well-being, and not all of them have to be physical activity related. As I said earlier, for some people, I am the biggest fan of physical activity, but there are some people it's just not practical right now. And there's nothing worse than giving your everything to all parts of your life and feeling like you're coming short. So we really want to be supportive of people. I do think that with an example like an activity challenge, really making sure that you design it to be accessible and inclusive to all levels of fitness, and to not just celebrate the marathoners, for example. So, it's going to be a case-by-case basis, but I think the most important thing is to be very respectful of that line and to be very sensitive to it in whatever you're offering. All right, next question. We do quite a bit to support well-being, and I'm proud of our organization. One concern is the impact of this workforce crisis. Yep. particularly residential workforce. These staff are doing huge amounts of overtime. We have to cover gaps in coverage, pay incentives, are just getting exhausted because there's simply not enough staff to do the job despite extensive recruitment retention efforts, including bonuses. Oh, I mean, that is a very real challenge that I don't know if I'll be able to just give you a magic bullet solution right now. It's really requires sitting down and thinking about it strategically, which I imagine you've already done quite a bit of. So I think, first of all, don't give up on the small stuff. You know, I know sometimes when people are at their breaking point, when it just feels so overwhelming, it can be easy to just kind of set those small things aside, the stretch breaks, the bringing in healthy lunches, the employee recognition, all that. Continue to make those things a priority. Regular check-ins with people, making sure that people feel heard, supported, appreciated. Being creative and open to suggestions from employees. A lot of times the people who are living it have some of the best ideas for how to improve it. So I know somebody mentioned earlier, like the town hall idea, maybe considering some sort of moderated town hall with your employees. And also the surprise and delight, you know, in these times where it's just really hard. Don't underestimate the power of just doing, you know, of course, you know, budgets are different for everyone, but think about what your budget will allow. The cost of losing an employee is so high. So sometimes it's worth it to make a little bit of an investment to do something that, you know, that really surprises your employees and makes them feel appreciated. And thinking about how you attract new talent, right? And thinking about your well-being strategy might be one way to do that. So I talked about packaging and marketing your well-being offerings. So you could certainly work with your recruiting department and trying to build that in to really, you know, build the story for why individuals should come and work with your organization. And that can also help give your current employees a little bit of a light at the end of the tunnel. So making them feel like, yes, this is something we are continuing to work on and that we're, you know, finding new ways to figure out. Like I said, that's a very multifaceted topic that we could probably do a, you know, half-day work session to try to dig into that more. But those are some ideas that come to mind. I know we're running out of time, but I do, and if I'm not able to get this fully answered, I will. I'm happy to follow up. But I hated the various workplace wellness programs. Okay, they made me feel guilty, and I didn't want my coworkers to see me sweaty and vulnerable. I totally appreciate that. Yep. Oh, I didn't get to read the whole question, but I think maybe it's me answered. Okay. Leading by example is so important in giving people the option and the choice, and yet nobody should be forced to get all sweaty, and that's not what some people are into, or they'd rather do it on their own time, and that's perfectly fine. It's about well-being is about meeting people where they're at, and I know we're out of time, so I'll just close it at that. But I really appreciate the questions, really appreciate the audience engagement and the opportunity to present to you all today. Thank you.
Thank you so much, Vienna. Thank you all for being here and for participating. I love when that chat box just goes off. So the next and final session of today is going to be a nonprofit lawyer's perspective, cultivating a culture of professionalism, integrity, and accountability with Mr. Ed Spinella, who many of you know from Martha Kalina. That will start in 15 minutes at 12:45. So you've got a little bit of time. Again, just a reminder, we'll put this recording up tomorrow, so you'll be able to access it. And then I think that's it. If we don't see you in the next session, we will see you tomorrow for day 3. Thanks, everybody.